Okay. Hey folks, I'm Dr. denBoer, presenting on ADHD tonight. It's a fascinating, critical topic affecting so many of our kids and adults. And I'm going to have Dr. Tamara Rosier with us. Dr. Tamara Rosier, I have permission to say this, has been a patient here for over 15 years. We were just discussing that. And it's been a privilege. And she is the founder of the ADHD Center of West Michigan. So she has a lot of experience in this field. She is very passionate about this and has some very unique tools to discuss with you that there's no way I could present that. So I'm thrilled to have her complement what we talk about. I'm going to talk about what we're good at, and that is functional medicine, right? So the purpose of tonight's talk is functional medicine and behavioral coaching working together to address ADHD more effectively, right? One can get you somewhere, the other one can get you somewhere. You put one and one together and all of a sudden you have a factor of 5 or 10. It's a really important topic because with ADHD you start learning coping skills on your own that are often erroneous. And we have to reprogram these kids, because why I found that, yeah, you work on some central tenets with nutrition, and wow, there's definitely differences in behavior, but they don't always know what to do with that. So it's like a retraining and unlearning of bad skills. And this whole topic is just such a huge topic. There are so many damaged kids out there. This topic is very broad. There's touches of ADHD, and then you can also even start talking about the autistic spectrum, which has overtones of ADHD, but is not ADHD. But still, I feel that some of the damage that's occurring to our kids out there has different ways of expressing themselves. Some of them is just an anxiety disorders, others is just acting out, right? And others is ADHD, and then all the way into autistic spectrum disorder. We are dealing with an epidemic of it. And I have the fortune of having both one foot in Europe and one foot here. I'm from the Netherlands, as many of you know, and go back very frequently to harass my siblings. And they only allow me to stay 3 days now. That's the new agreement. So, I see the statistics out there, and ADHD over there is not nearly as common as it is over here. The medications like Adderall over there, they go, what? You're doing what to your kid? It's just not done. And so there's profound differences in kids' health there as well. I find with great interest that kids over there, asthma rates are less than a quarter that of ours. Allergies, just plain old environmental allergies over there is fractional compared to ours. And they have a climate that's very conducive to allergies. Yeah, think Seattle weather. Very wet, always moderate. Yeah. So obviously they are doing some things differently than we are. And we're going to discuss that because I feel our kids can achieve that wellness as well as they can. So how does it connect to ADHD? The ordinary approach in this country, and I had to sit through this with a bunch of teachers a long time ago. One of my kids was apparently very ADHD-like. So I was called in for a meeting along with my wife, and we had to sit down, and in they paraded teacher after teacher after teacher to make the point, my kid has severe ADHD, is not able to thrive because of that, and on and on and on. So I was a little bit naughty here. I asked a question. So when you ask him a question, what did I just talk about, or do you get this? Do you get the right answer? Yup, every time. Well, maybe we're not quite talking ADHD then, aren't we? And I was playing a little bit dumb. They did not know I was a physician because I wanted to experience what the parents, what kind of pressure they are under. And if I didn't have the backbone of a physician and knew better, I would have totally agreed with him. Yup, this kid needs Adderall. There's no question about it. Overwhelming case, slam dunk, guilty. But that wasn't the case at all. So Adderall and drugs like that are used to cover up behavioral issues in the classroom also at times. So sometimes I feel like it's not true ADHD, and we have to watch for that as well. So be careful with the label. It's not always what it appears. There could be other factors as well. And that's not my area of expertise, but I just wanted to throw that towards Dr. Tamara as well, because I'm sure you get people over there that really don't fit the mold. Okay. So the allopathic medicine approach is just to throw a pill at it and treat it as a problem with the brain, and that's it. And they get results because now all of a sudden Johnny is sitting still. I have a patient who went through this, and I said, so really, what did you feel? He says, well, I really wasn't learning better. I felt just kind of like zoned. He called it the blue zone, just bzzz. He says, everybody was happy with me because I wasn't acting out, but it really wasn't helping my brain. And I found that explanation quite fascinating. The functional medicine approach is, in my humble opinion, much more elegant, because now you're trying to go after what is going on. Is there situational problems at home, right? First of all, are the basics in place? Are we getting enough sleep? And then we have to go after all the things that could impact us, right? With ADHD, for example, the detoxification pathways, are they working in this kid? We'll do a heavy metal analysis because we know heavy metals really affect brain, and a simple urine analysis can reveal lead or mercury or excessive copper or what have you. So that should be standard protocol for anyone with ADHD. Make sure that we have the heavy metals tested. Are the hormones off balance? Because as any woman will tell you, especially females, if my hormones are off, my brain is off, right? And in kids that can manifest itself totally differently. So are hormones balanced? The musculoskeletal system, where did that one come from? The musculoskeletal system, well, guess what? This from here to here, this thing called the spine, houses the nervous system, and it's attached directly to the brain, isn't it? So if the nervous system somewhere along the way is being irritated, you better believe it will irritate the brain as well. Fascinating little case. I have an 8-year-old patient who was in last year, and this was the beginning of the school year, so into October, November-ish. And mom was coming in desperate with this 8-year-old because this 8-year-old had not been allowed to play outside for recess a single time since school started because he had to do makeup homework all the time because he wasn't paying attention and just not getting things done. And I was thinking to myself, well, it's probably the worst kind of punishment. This kid needs to be outside. But I decided, you know, I am finding intense amount of tension up through here. Let me work on that. And with very specific, gentle manipulation, we got some release there. I coached mom the things that I'm going to talk about and came back a week later because I told him to come back weekly for just 3 visits. And this little 8-year-old had been outside every time since. Yeah, dramatic, the turnaround. And not every case is like this, but I'm just showing this as an illustration that for some of them, it's actually a spinal issue that can have a profound impact. Because you know what it's like when your neck is way off, you can become irritable. And kids react differently than adults do. So as you can tell, I could spend all night on this whole system, but it's important to have a good workup and figure out what system is impacting your health. And it could be many multiples. It could just be a toxicity problem. It could be especially a gut problem. The gut is the second brain. That's what we call it in Europe. If you come in as an adult with depression, they will consider that a gut problem first. If you have an anxiety disorder, gut problem first. ADHD-like symptoms, gut problem first. Because the gut truly is the second brain. It houses 92% of your brain's neurotransmitters in the colon alone. It's unbelievable. The amount of nerve endings that are right in the very first part of the small intestine, right where it comes out of the stomach, there's more nerve synapses there than there is in the entire brain. It's constantly tasting and analyzing food, figuring out what to do with it. Highly, highly complex. So if we have something going on in the gut, it will almost certainly have a profound effect on the brain one way or another. The way it works is the gut houses all these neurotransmitters because it's constantly working. If it's now impacted by a food that it's reacting to, a chemical that's new to man, an antibiotic, or just plain stress creating leakiness, indigestion, we've all experienced that. All of a sudden, we are affecting the percentage of neurotransmitters in the gut, which then directly translates to the percentages over here. On top of that, if the gut becomes a little bit leaky gut syndrome we call that. We've known about this for over 100 years, by the way. It's just finally being recognized by the American Gastroenterology Association as of 4 years ago. Okay, I am absolutely thrilled with that, but we have so much literature on this. Leaky gut syndrome is nothing more than the gut becoming more permeable than it already is. Everybody has permeable guts because the food has to transfer over into the blood, doesn't it? But if you're under stress, and this happens with anybody, let's say somebody cuts you off on the East Belt line, all of a sudden your gut is 10 times more permeable. And that resolves itself after an hour. But let's say you had that stressful event and then you slide by home and have something quick to eat. You'll probably upset your stomach even further because your gut is very, very leaky right now. If you're under constant stress, and this could be sleep deprivation, this could be overtraining as an athlete, this could be marital stress, it could be anything. You will create that leakiness of the gut. And now the body is no longer able to absorb the nutrients in a proper way. And let's say you ate something that you're somewhat allergic to or can't digest well, and you're fermenting it because of overgrowth of yeast or other bacteria, and you're creating all kinds of weird chemicals. This is very common. And you have that leakiness of the gut. It'll go right into the bloodstream, start circulating around, causing an inflammatory response, and it can cross the blood-brain barrier, we call that, creating an inflammatory response there, which then creates that irritability. I still so remember the day that I saw this in one of my own kids. One of my kids is very much an adult now, but it's funny you always say kid, but in either case, very, very sensitive to red dye, which by the way is illegal in all of Europe because we know it is really bad for the brain. It's been linked to epilepsy, so seizures. It's been linked to all kinds of brain issues. Was exposed to this red dye, and I watched this then 3-year-old, his pupils just got really, really tiny, and he started throwing himself on the floor and just flailing in some anger episode for over nothing. I thought, wow, the power of what food, quote unquote, it's not really food, what it has on the brain. I also found out that it takes 3 days to overcome that. Not much fun and definitely not worth it. Yeah? So, food has a profound effect on the brain. It can make it happy or it can make it very unhappy. And there are certain foods that for anybody with brain conditions, and really anybody, period, should be avoiding. And those are new to man chemicals. If you have chemicals in food, it's probably not legal anywhere else except here because we have a very powerful food lobbying industry. And especially the food colors are very toxic for the brain. Artificial sweeteners, every one of them, very toxic to the brain. And sugar. And sugar, unfortunately, in this country is not always sugar, but it's corn syrup, which has 5 times as potent as sugar. Corn syrup causes an insulin rise, which is many times higher than sugar by itself, even gram for gram. Now, why is this important? Anytime you load up with sugar, you're going to release insulin. Yeah? Insulin is a hormone that attaches to the insulin receptor on a cell, allowing sugar to enter so it can be metabolized there as energy. Right? Gets the sugar out of the blood to wherever it has to go. So it's a good thing. However, with a lot of sugar, you have to go with a lot of insulin. That makes sense, right? all of a sudden now we have way too much of this hormone flooding everything else. It drowns out the other hormones and it becomes an irritant and it creates a systemic inflammatory response. It's called insulin resistance when you get to this point. And no one's immune to it. It's partially responsible for the diabetic epidemic we're experiencing today. This inflammatory response especially hits the brain. And that's why I'm watching aghast how these treats and pop and everything is used so casually in the classroom. I think, these poor teachers, they don't know what they're doing to their kids' brains, and they're wondering why they're so tired going home at night because of these kids all acting up. There should be a huge movement afoot for actually having an actual lunch instead of this 20-minute little rush that they get, and making sure there's no pop machines in the hallways, and that the restaurants and the high schools actually serves food instead of these new man-made whatever they are serving. Yeah? This is absolutely critical. So food has a profound effect. Our environment has a profound effect as well. Mercury is really high in Michigan because we have these lovely cement plants that just spew it into the air and it comes across towards us. Mercury poisoning is very prominent. It creates yeast overgrowth in the gut, and it's an extreme neurotoxin. Extreme. Very difficult to work with. The environment can also, do we have a nurturing environment at home? Is the TV on all the time? Just basic things like that. TV and texting and any blue screen, there's something about that light that agitates the brain. So it's not even the quality of the program I'm talking about. I mean, that's a whole other topic, and I'm not going to go there. Yeah? I'm talking just physically the blue screen. It has a profound effect on brain chemistry, especially if you use it before going to bed, because it does impact sleep the entire night. But doc, I use it to fall asleep. Yeah, you do fall asleep, but the quality of sleep is profoundly affected by this whole thing. Talking about sleep, research was just published about a week ago that sleep is utilized by the brain to sort through what's important and needs to be memorized and what can be discarded. Because we form many, many memories and emotions, and all kinds of data gets stored on our hard drive every day. And if you have too much of it, you will not be able to focus on what's important and prioritize. Sleep reorganizes the brain. Does many other things as well, but that's our topic tonight. So enough sleep is another very important component in our environment to have. So we've got sugar, the insulin resistance, we've got sleep, we've got the emotional environment that is important. We have the blue screen, and we have the new to man-made chemicals that we need to really work on. Medications are also really tossed about casually in our country. It's really quite disturbing. Amoxicillin is like the new pink candy for babies and kids, toddlers. 1 round of amoxicillin for an ear infection, which doesn't make sense anyway because almost all of them are viral infections. But 1 round of amoxicillin, its damaging effects can still be measured on the gut 2 years later. And remember, the gut's a second brain. The amount of antibiotics used in this country outpaces most European countries 10-fold per capita. So another medication, it really is fluoride. It's on our water, unfortunately. It has been banned in most of Europe because of its negative effects on the brain. There's other issues with it as well. Antidepressants. An antidepressant, after 9 months of use, also has a depressing effect on neurotransmitters in the gut. And how could it not? Right? For example, the serotonin reuptake inhibitor, which is the most common ones like Prozac. Yes, it affects serotonin levels here, but it's also going to affect serotonin levels here, thus affecting gut function, which then starts becoming more and more disabled, more leaky. You start getting more and more food intolerances, which then in turn causes depression again. This research was so controversial when it was first published 4 years ago that the researchers decided to assemble an entire new team and repeat the test, and they got the same results. University of Groningen in the Netherlands did that research. So the gut obviously is one of the first places to start, right? Rebuilding it, what we do is first use food as medicine. Always start with food, right? And we reteach eating. Eat when you're sitting down, not when you're watching a screen. Actually eat slow enough that you can digest. Make sure it's real food. Make sure the label your great-grandma would have recognized, right? Just really basic stuff like that. We often will eliminate certain anxiolytic foods. That means producing anxiety. And that would be gluten, would be number one. There is so much data on gluten and ADHD. I have seen that single food group, besides the chemicals, that single food group be the most profound in positive influence on ADHD. And that is because gluten has been profoundly changed from 40 years ago. Profoundly. So we have messed with nature, and we have glutenized gluten, where some forms of grains, some wheats, now have more than 30 times the amount of gluten than they did in the past. It's been irrevocably altered. And unfortunately, our kids have become sensitized to it, because how could you avoid that? Even if you have parents that are conscious and using ancient grains, right, the real deal. But Johnny may have had 1 dose of amoxicillin. And Johnny may have not had enough sleep, and then goes over there and they have that wonderful birthday cake. That could be enough to sensitize. And after that, even the best high quality non-GMO grains are going to be reactive. Because I'm saying this, trying to say this in a clear way, because most people think, well, if gluten is bad, then I'll go to the ancient grains. And at that point, it's done. You are a reactor. And this reaction hits something called the opioid receptors within the brain. And I can tell you that some kids go through withdrawal when you take them off. Not just emotionally, but a literal withdrawal between the 4th and 6th week, where symptoms are actually worse. And I just really am there with the parents, hoping and praying they'll hang in there with me, trying to do what we can to have them go through that withdrawal phase, and then they come out the other side in much better shape. So food can also be an enemy to some of them. Corn tends to be really high in the list. And I grimace when I'm saying that, because I don't like taking away food. But in the beginning, we take away some foods and then reintroduce and figure out what's going on. Dairy, very, very common as well. Hard to digest. When the gut is compromised, dairy should be avoided, because a lot of them just can't break it down. And it causes an inflammatory response. So some of the nutraceuticals, we've had a lot of very exciting research. Every one of these has been clinically trialed, written up in top-tier medical journals, and on an ongoing basis has accumulating clinical data. In other words, practitioners are also reporting how things are going, so we're accumulating this big database. For example, Biostrath is from Germany. It's got a German Commission E stamp of approval on it, meaning it's got 5 years of clinical trials on it. It's been tested by outside companies, not just the company itself. And that's a really important distinction between US and Europe. Here the company tests its own pharmaceuticals for side effects and its effectiveness, and then publishes it, and no outsiders are involved. And to me, I'm going, that's a little weird, because there might be slight bias there. But Biostrath is a totally plant-based product where different plants are being combined, so it's exceedingly high in specific oils and as well as B vitamins. And the average C student becomes a B student with just that, no lifestyle changes, in 3 months' time. It's Biostrath. It can be used as a multivitamin. Attentia is relatively new on the stage. It's been out a few years, and it's been clinically compared, trial-wise, to Adderall and outperforms it, which is pretty shocking. Attentia is a combination of specific B vitamins, fats, and the extract of green coffee bean. So there's a certain type of caffeine that gets pulled out of it, combined with another amino acid called L-theanine. And that combination gives the brain, a wonderful ability to concentrate immediately. So if somebody needs to have some results now, this is what we use. We never use just that though, right? We still use food. We still want to uncover the whatever the condition is. So it's a temporary jump. And also, it can be used just with, if you've had a long day and you're studying for a master's degree at night and you need a little, you need a little bit of boost. That's what you do. That's what you do. Very specific fish oils, which is mostly DHA, also has a very relaxing effect on the brain. It really creates repair networks, and then there's the children's version of it. Something that's also very new, and this is from Rotterdam, my hometown, Ultra GI Replenish. The research comes from Rotterdam, and that's there's a place there called Erasmus University, and it's really renowned for its gut research. And they have been able to crack the code of colostrum. What makes colostrum, the first 3 days of breast milk, so incredibly successful at prepping this little sterile gut of a newborn to support good bacteria for life and provide immunity for life and give the body the right signals for life. These immunoglobulins turn the lights on. Yeah? They've been able to isolate which ones able to naturally synthesize it and put it in this medical food, which we now know after just 1 month of use increases the healthy bacteria an average of 1900% in the gut. 1900%. It also causes an incredible amount of bad bug die-off. They tested 8 bugs and 7 of them were totally gone after 4 weeks. In fact, changes happen so quickly with it that I sometimes have to, whoa, back up, let's just do a half a scoop instead of the 2 scoops you were doing and make sure that the patient can do well. I have found that those people who have not been breastfed that do this, that I have to ease them into it because we're resetting the whole gut, and it's phenomenal the changes that occurs. Those that have been breastfed, but say had too many antibiotics or something like that, I can be more liberal with. So that's a really cool one. Along with this medical food, Neurosupport. This is based on the work from Dr. Perlmutter. He's a best-selling author. Dr. Perlmutter is a very famous neurologist who deals a lot with neurological conditions. And he initially made this as a detox for the brain, so for MS and Parkinson's patients, and it is extremely effective for that. But anytime you support the brain in any way, it's wonderful for ADHD, so we're using that for adults. Yeah, we're using that for adults. Probiotics, of course, are absolutely critical to reseed the gut because the microbiome, we have so many good bacteria in our gut, 10 times as many bacteria as we have cells in our body. We are barely human, we're mostly bacteria, and they provide the barrier, our immunity, our ability to digest, hormone balancing, they control sugar levels even. There's so many things that they do. So the brain is incredibly dependent on our microbiome. We have one for kids, and the ultraflora spectrum is for adults. Kills both yeast and puts in the good bacteria. It's a must do. There's not a single ADHD case that comes to my office that is not on one of these probiotics. So that's one of those must do's. Good. Dr. Tamara.
I always love listening to the function of ADHD. You're going to hear me switch gears, and I need you to understand, as I switch gears, ADHD in the brain looks different. Now, I'm not talking about people who say, oh, I'm so ADHD today. And one of the first questions I ask, like, are you really, or are you just being forgetful today? Because there's an actual difference. And so ADHD brains are wired differently. They're also structured differently. And so it's often said that ADHD people have two speeds, on and off. It's like the rest of you guys have a dimmer switch that we just didn't get at birth. Now I'm going to ask you to just take a quick risk here. How many people know someone with ADHD? Okay, keep your hands up if you're actually diagnosed with ADHD. Okay, thank you. How many people have children with ADHD? Okay. All right, so working with ADHD is tricky. We're a lovable bunch, and by the way, I do have ADHD. Starting the ADHD Center was like me coming out of the closet. I managed to create a career in higher ed where I just kind of, oh, look, I'm the forgetful professor. Aren't I cute? But now coming out, people will say, oh, you have ADHD. You probably did that because of ADHD. And because there's a lot of embarrassment associated with it, I learned to hide. And so tonight, we're going to talk about the emotions in ADHD. And we could talk about so many different things tonight, but tonight we're just going to focus on ADHD folks are wired differently, and they're wired differently emotionally. So recent research reveals that those with ADHD have a significantly more difficult time with these items. Now those of you, yeah, okay, I see some of you moving your heads, so I'll read them, okay, so you don't have to strain your neck. Low frustration with tolerance. Some of you went, check. Impatience, check, check, right? Hot temper, excitability. Now I'm also married to a man, ooh, this is being recorded, this is going to get a little bit awkward at home. I'm married to a man who has ADHD too. So Wednesday nights when our trash gets out to the curb, we're high-fiving each other all over the place because we're rocking life at that point, right? Now, I like to think of my ADD as the delightfully whimsical kind. I just forget to pick up kids, forget where my keys are. Whereas my husband, he goes immediately to impatient. Like, I can't do this. And it's not as whimsical as mine is, clearly. Now, something that you need to know is the brain is different. So in the front part of your brain, that's called the prefrontal cortex. If you look, this is where the prefrontal cortex makes decisions like what we're going to pay attention to, behavior and judgment, and emotional responses. If you have ADHD, it is unlikely you have access to that. This is what that means. fMRIs are images of brains. When we take images of brains, this part is dark on fMRI scans. Which means we're not just being a jerk when we're not paying attention. And we're not being lazy when we're trying to procrastinate. And I'll explain about that. We actually don't have as much accessibility to this, if at all. Okay, short-term memory is also housed up here. So people who did identify as having ADHD and you're like, what was I just doing? That's a short-term attention. So when you have ADHD, emotions are electrified. May I see the hands of the people who have children with ADHD again? Okay. I need your confirmation here, right? Have you noticed that they get set off quickly? Or cry easily? Or disappointed? And you're like, it was just a donut that fell on the ground, right? I just worked with a parent this morning who was saying this about her child. So without the use of the prefrontal cortex, many ADHD people will fasten onto a feeling. And so what happens is where non-ADHD folks will go through the world and just kind of use that prefrontal cortex without even understanding that they are and say, I'm going to do this and this and this. Instead, I look at my clients and say, is there anything that you don't have a feeling about? That you just feel meh about? And the answer is nothing. You're laughing. It's true, isn't it? So true. And the feelings are strong. And so what happens is when we don't have the prefrontal cortex to guide us, we lock in on feelings. And I know something about my practice, that I hire coaches who are immediately likable. Why? Because a client will come into my office and I have 10 seconds to be immediately likable. Why? Because they go through looking for a feeling. Fortunately, I work with a lot of adolescents in high school, and they'll gripe with their parents all the way there. I don't want to be here, I don't want to be here, you're stupid, everyone's stupid. And they leave, and I literally heard the other day, or actually this was a year ago now, one young woman say, you know, you should probably go see Tamara too. And so she thought it was a good idea to see me, and her parents should probably see me too. But do you see, I had a few minutes to work with that feeling. Extreme responses may be due to a flooding. It's actually called an amygdala hijack. I know this is a little bit detailed, but there's a little tiny part of your brain called the amygdala. And the amygdala is very important to us, and we actually listen to it a ton. It's the size of an almond. And yet the amygdala tells us what's dangerous, what's not dangerous. And when we have ADHD, people tend to respond with amygdala hijack. And that's what you're seeing in young children with ADHD. That's what you see in your spouse, loved ones with ADHD. So what happens is they fasten onto a feeling. Again, this is being recorded. I just won't let my husband watch this, okay? Because we worked on a home project. And he doesn't like to work on home projects, but he does like to work together. But he started this, I'm not good at this, I'm not good at this. He was fastening onto the feeling. Can you name the feeling? Someone just say it. It's okay. I'm not good at this. I'm not. What's the feeling?
Insecure.
Scared. Good. Inept. Okay. So he was starting to fasten. And then all of a sudden, a board didn't fit. What happened? I can't do this. Right? And he left. Now, of course, me being the pure saint that I am to live with, fully understood everything that was going on and said, I understand you're attaching to a feeling and you were flooded at the moment. Oh, no, that didn't really happen. That was make-believe. Okay, so what happens is when one focus crowds out the others, important information gets lost. And so this is what happens to children in school with ADHD. Oh, I hate history. Oh, I hate history. Oh, I hate that guy's voice. Why does he always do that? Oh, I hate that guy's voice. Now, fastening on a feeling, can you name that feeling? It's distaste. Okay, right? Dissatisfaction. Focusing on that and starting to shut down like, oh, why does he have to make that slurpy sound when he talks? A student told me that last week. And then all the emotions are crowding out other information that should be coming in. Do you see what's going on here? Okay, now, at this point, I want you to understand, you can't say just stop it. That's not how this works, okay? What we have to do is reprogram the brain. For many people with ADHD, and I won't go into this, but the brain's gating mechanism between regulating emotion, it doesn't exist. And there's two networks that actually get confused, and the seesaw is supposed to go up and down between the two networks. It actually, like, it gets stuck, okay, which causes daydreaming, which causes confusion. And so a lot of ADHD people don't know the difference between dangerous threats and minor problems. You're nodding. Good, thank you. What happens is we're not sure. And so I will see adults who are in bankruptcy going, oh, it's all going to work out. No, you have to do something, right? Or I'll see adults who, someone at work is after me. Well, is this really a dangerous threat or not? Do you see how the brain gets mixed up? Now, with this barrel of fun, many people actually learn to hijack their emotional brains. And it's because the bright people go, gosh, my brain is different, and I don't like this. And by the way, that usually happens between 3rd to 5th grade. Boys, usually it's 4th and 5th grade. Girls starts at 3rd. So as young children, they're sitting in class going, I know I'm different. How did everyone else know to turn in their paper and I don't? And so what they learn to do is to hijack, how am I feeling? And they learn to use it. And so emotions drive action. All right, I just want to scan, how many people are with me so far? Okay? All right, think about the person you know, love, or yourself. If emotions motivate action, the smart person learns, all right, I'm going to trick myself into doing stuff. The smarter the person, and by the way, ADHD has absolutely nothing to do with intellect. In fact, I work with incredibly intelligent students, entrepreneurs who have IQs well over the median. So this is not an intelligence issue. This is, one writer says, it's like having a Corvette engine in a VW Bug. Right? It's frustrating. And the smarter you are with ADHD, the more frustrating it is because you know you're not normal. And darn it. So here's something we do. If I feel bad about it, how about I not do it? Okay? So schoolwork makes me feel a little bit icky. I just won't do it. All right? I used to have a dog who was quietly defiant. And if I called her and she didn't want to come to me, she'd just go like this. That's kind of what you see. Okay? And if those of you who are married to someone who has ADHD, you'll see that kind of working out. Except it might be staring at the phone or TV. So avoidance is actually an action for ADHD folks because we're walking away from something. Now there's other unhealthy tools that ADHD folks pick up. Anxiety. Anxiety is like gasoline. Anyone with ADHD, can I just get an amen here? Because if you have ADHD, you've learned to hijack your emotional center to freak yourself out in the morning and to leap out of bed. Do you ever know you do that? Yeah, I used to scare myself out of bed in the morning each day. I used to think that was normal because that's how I motivated myself, right? And the busier I kept myself, the more I'd freak myself out. Now, time out, if you're neurotypical, not ADHD, this is going to sound like science fiction. But those of you who have ADHD or know someone with ADHD, you're with me enough to go, yeah. So could you just like nod like, yeah, she's telling the truth? Okay, good. Because anxiety is what we run on, which is why many of my clients are diagnosed as generalized anxiety disorder. I said, well, let's just work with the anxiety. Sure enough, that was so high, I can see kind of what's happening with the ADHD. All right, the next one is procrastination. Now, this is genius, and it's a trick we learn young. We learn to combine avoidance with anxiety to produce this wonderful thing we call procrastination. It's genius. And you know why? Because it works most of the time, except when it doesn't. And I have students come in, and it's like, they're like, yeah, I stayed up all night writing a paper. Who's winning at life? Ah! And they high five. Like, dude, that's not what you're supposed to be doing. Here's what happens with procrastination. Your anxiety gets so revved up, you're actually getting parts of your brain excited, and it's the parts of the brain that are also very sensitive to addiction, and so you get a high from it. You feel like you've cheated life, right? Why would you not use this one then all the time, right? Except that it doesn't work. I may or may not use that tool myself, but I cannot say. Shame and guilt. After this one, they start to get a little bit darker. Because here's what happens. Procrastination fails you enough. By the way, sometimes the world rewards my procrastination. I'm like, huh? See? It all worked out now, didn't it? And I tell myself, that's fantastic. Let's do that again. A lot of times it doesn't work out. Say I stay up all night trying to write a paper, I'm exhausted for the next night because I'm writing checks my body can't cash. So then I start to dig deeper to motivate myself. I use something called shame and guilt. Shame and guilt, I have them kind of as the same thing. It's when we produce this really sad, sorrowful emotion to make us do things. It's amazingly difficult to work with a client who uses shame and guilt to motivate him or herself. I work with children as young as 8 years old, and some of the brighter children already know to use shame and guilt to motivate. And it's heartbreaking, and it's a cycle we have to break. So far, are you understanding what shame and guilt does? Is that? Okay, thank you. Shame comes from comparing ourselves to others or going, my brother can just sit and do his homework. Why can't I? I'm just tired of letting people down all the time. I'm tired of this. And so they're trying to go, yeah, do it differently. And it's like they hit their head to try to get it done differently. Sometimes parents unknowingly say, I don't know why you can't just sit and do your homework. Or they'll punish students for not getting the right grades. That doesn't make the parents jerks. It makes the parents unaware of the shame and guilt involved. Over the weekend, I had a parent call and said, really, my son behaved quite poorly. I'm grounding him to his room. I called her and said, please don't. Go in and talk to him, help him process first. She goes into the room. He's wearing PJs. He had put a number, because he thinks prisoners wear numbers, big numbers like football players. And so he was sitting on his bed like a prisoner. And let me tell you, that was his shame and guilt. He wasn't trying to be cute, even though that was kind of adorable for a 10-year-old. He's highly intelligent, but he was trying to teach his brain, don't ever talk to my mom like this. Feel the shame, feel it, wallow it. And he's trying to teach his brain. Do you get how he's hijacking his emotions? Last is self-loathing. This is the darkest tool. I have to pry this one out of people's hands. And self-loathing, and those of you who are adults with ADHD, you probably do know what I'm talking about. For those of you who don't have ADHD in the room, self-loathing is when you beat yourself up and berate yourself to the point of just doing it. But then you do it, and then I did it, but that's not a big deal. I'm actually grateful that I didn't understand about these bad tools before I was working on my dissertation, because I used all of these. I have a PhD because I used all these bad tools. You want to know what happened to my health? It was bad. So all these tools come at a cost. And all of these tools are detrimental to my emotional and mental health. I'm also using all these tools in very ineffective ways. So these tools seem to get us to promise us things, but in the end, it's a fool's game. Self-loathing, I was working with a man who was in his 50s, and I said, okay, I hear a little bit of self-loathing there. And he'd say, no, Tamara, you don't understand. I'm being quite accurate in my representation. I let it go, okay. And for 6 weeks, I kept going, now, is that self-loathing? No, Tamara, you don't understand. Oh, okay, all right. So around the 6th or 7th week, he started to say something. He goes, nope, I heard it that time. That was self-loathing. And so what we had to do is we had to kind of walk him out of the self-loathing trap. He was so used to hating himself to get things done. Again, emotionally hijacking himself. So ADHD coaching, this is what I do in the center. We're concerned with helping people live. This is different from counseling. I'm not really there to help you figure out how you got here. I'm here to help you get a map and drive out. Does that make sense? So ADHD folks are notoriously bad at time management, organizational skills. Emotional management is actually where I start most with most of my clients. Because until we can self-regulate emotions, these other two aren't really going to help us. Memory problems. Okay, I'm not a magician, folks. I can't make people remember to take out the trash or not forget their lunch or turn in their homework. Okay? That's above my pay grade. However, what I can do is help people learn tricks and strategies so that they are less forgetful. If you followed me around, you'd notice that I'm quirky. And I like to call it quirky because I've developed certain things. So, for example, I don't lose my keys. I have my keys in one place and they stay in one place. And if I take them out, I put them back immediately. I almost look like a robot while doing it. And you might even hear me say out aloud, "Put keys back, Tamara." "Why, thank you, brain." And they go back. Do you see how that's a strategy for us? And we also work with other functional difficulties. For example, and I didn't get into this tonight, but many people have problems with relational, with siblings, with parents, with friends. ADHD students, the bad news is they tend to run 1 to 2 years behind socially. And if you're a male, it's even longer. And so there's a lot of work we do that's behavioral. And the reason why Dr. denBoer and I wanted to talk together is because it really takes the two sides working together. It takes both of us to figure out, okay, functionally, stop eating sugar, okay? I mean, my clients aren't allowed to bring sugar into the office. I have a sugar-free zone. I'm called the sugar Nazi, by the way, by some of my younger clients. But we have to get the brain and the gut aligned. And then we have to work on the behaviors. How do we emotionally align ourselves? With ADHD coaching, individuals clarify what's important to them. And we actually, in fact, I was working with a woman today. She's in the DC area, very intelligent woman. She is so intelligent that she could go in 100 different directions. And I have to say, but we can't. So which direction are we going to go in? And so part of the coaching helps her take one step at a time. Something you will hear me say a lot is, we need to slow the brain down. We need to slow the brain down. And those of you with ADHD understand you can go 100 miles per hour and not even understand. Sometimes my brain will go so quickly, my mouth can't keep up. Some people are like, yeah, I'm not really surprised. In coaching, people identify, hey, this is what's holding me back. One of the unhealthy tools that some people learn is anger. And I didn't include that in the 5 basic tools because it's a special case that I see. I see young men using it, and I see certain types of personalities use it. And perfectionism is another. And what they do is they harness the emotions to constantly live in a state of anger. Oh, whoops, that really holds us back. And that holds us back from a lot in life. And so we try to identify those kinds of obstacles. We learn what truly motivates them. And so that we go back to the values for that. And the biggest thing I care about is how are we going to work with it? So coaching does 2 things. What's happening, learn about your brain, learn about the structure, but also let's find something to do about it. I'd like to take a stab and then you fill in the gap. Is that okay? Because
Go for it.
Because the ADHD brain is wired differently and structured differently. And I'm talking the truest case of ADHD. We can see it on fMRI scans. We can see structural differences. It does mean that is not environmental, but they haven't hit the wall. Lately, I've been dealing with a lot of women who are in menopause. They're coming to me saying, I'm losing my brain. And they went and they were actually identified as having ADHD. Well, they were actually perfectionistic enough to keep it together with this almost like OCD-like obsessiveness, but now that's failing. Do you see how that was kind of a sick tool? So I say you're born with it.
Yeah, I think it's really hard to be black and white. So classic ADHD, you are definitely born with it, and it's actually mom's toxicity who inherited some of it from grandma. 20% of a woman's toxins gets passed on to a baby that you've stored. So in a way, I am storing my grandmother's toxins right now. See, and if it happens to be a neurotoxic, then it certainly will affect the brain development, and thus you are born with it. Yeah. However, there's also these environmental things. A woman going into menopause during that time has on average 10% brain shrinkage due to hormone changes. It's unbelievable. So yes, you are going to have things that are going to change, and some of them can be ADHD-like at that point, which then takes these same coaching skills to get through, but at the same sense, then you've got to get back into hormone rebalancing, and guess what? It comes back. So we'll call that a temporary case of ADHD. And then there's the case also where the patient is being exposed to what has become more and more of a toxin, and it could be gluten, it could be the red and all that, and that causes a temporary state of ADHD. Does that make sense? So there's, to me, it's kind of a gray zone. But if somebody keeps on assaulting their brain with that toxin, whatever it is, then they are going to be classified as ADHD, even though maybe they're not.
Yeah.
Yep.
In fact, in my practice, I can see the difference, because ADHD folks have a couple of cues that they'll give off almost immediately, and when I don't pick that up, I think in my brain toxicity, I start to coach the parents differently on that.
You both solely use the term ADHD. Where does ADD fall? Or what are the differences?
Yep. DSM just cut out the ADD. Now it's all ADHD. So some people will say it's AD capital HD, ADA. DSM, I think, is very behind in understanding ADHD. So
DSM is a diagnosis code book? Okay.
Yeah. They're just not really good at diagnosing it.
So everything you're talking about applies to
Yes.
AD. Somebody with
Yeah.
ADD might not be hyperactive, but have
Right.
similar symptoms.
Yes. Thank you for clarifying that. And that's something that now I wish I would have said. Yes. Good. Thanks.
Yeah.
I work it with the behavioral, so I don't say anything. I understand that people need to come to their understanding differently. I have doctors who refer to me and will medicate. Here's my preference, and this is what a lot of ADHD professionals will say. First, we want to try behavioral. We want to try the environmental. We want to try all the non-pharmaceutical things first, and then, and only then. And so I make a practice of not saying, because I have to honor parents. Not everyone has access to a Dr. denBoer and his office, and I wish they did, but I have to respect where they are. I would say two things. One, definitely going functional medicine to get things cleared up. So you have, let's say, for the sake of argument, you have the purest case of ADHD. You don't have a prefrontal cortex that even really remotely works. Still, the functional medicine is needed to realign things. However, along the way, you've learned bad habits. And you've learned some self-loathing bad habits. And so, actually, coaching helps you rethink and understand things differently. We have a program at the center that works with middle schoolers, and I love working with middle schoolers because if I can teach them how to think differently now, it's going to save them pain. When I work with adults, we need to kind of go back and go, okay, how is this not a helpful way of thinking about your world? Did that answer okay?
Yeah, so I will definitely second that. If you've been taking Adderall most of your life, and all of a sudden we kick that away, that was the pillar you were leaning on, and now all you have is those bad habits. Ouch, right? So it's critical that we relearn habits on how to function, and it's also critical that we're not doing things physically that agitate the brain, like I'll be oversimplistic again, the food colors, right? That makes an existing condition worse. Yeah, because for some, and I want to re-clarify that, for some people, and I'm going simple again, the red dye will give ADHD symptoms even though they're not truly ADHD. For those that have the classical diagnosis, their classical ADHD, red dye will worsen their ADHD. Does that make sense? So in either case, you got to get rid of it. Yeah.
Yeah, that's the answer.
Yes.
Kind of a two-part question and follow-up. Do you see a typical time frame of somebody coming off of kind of detoxing from Adderall? 6 weeks, 8 weeks, 6 months?
3 months.
3 months?
Generally.
Okay. And then long-term use, long-term negative health effects.
On Adderall?
Yeah.
And drugs like it?
Right.
You want to address that? You want me to? Okay. So, burnout of adrenals is one of them because it is speed. So it's like putting a little like a turbocharger on a little lawnmower engine, and eventually your adrenals will just give way, and that then creates all kinds of other issues. The adrenals also directly communicate to the brain. Cortisol has an inflammatory influence on the brain. It produces that insulin resistance when it's off like that. When the adrenals go off, you don't sleep as well anymore either, so you don't have that regenerative power. DHEA levels, that's one of the other things that the adrenals produces, drops low, and DHEA is the precursor to many hormones, which then in turn again affects serotonin and GABA and all kinds of other neurotransmitters. I just said a bunch of goobly glue, I understand, but the thick and thin of it that you will have to get out of this, it has a profound effect on adrenals, and once adrenals are not good, then that takes a lot of work to get them back. That's a 1-year process. Through health coaching, we've designed a whole program just for adrenal renewal. It's called Adrenal Renewal, and I'm putting out a video on that, short video on it, well short, about 20 minutes this month. So if you want to look on YouTube, I'm discussing that one in depth. So did that sort of answer?
And remember, ADHD habits are already stressing the adrenal system. Scaring yourself out of bed in the morning is already a stress.
Big time.
So you're tanking the adrenals.
So yeah, Adderall, what I've seen also, this is just a practical basis, so what I just said was science, okay? Adderall burns out adrenals. For some people it actually stops working. So it was great until 18 and doc, I don't know what happened. Now all of a sudden they're floundering because it doesn't work anymore and they don't have that pillar to lean on, and now it's really bad because they haven't developed any social skills, good skills, learning skills, none of that. And these are the kids that literally could end up homeless.
Yes.
Or the dosage increases then.
Yeah.
Or change to like Avoidance or a different category. By the way, if you see someone with strong ADHD tendencies but have high anxiety, please talk to doc about the anxiety. Because a lot of times if you can tamp down the anxiety, the ADHD symptoms go away. And it's partly because of bad habits and the gut combining.
What's the difference? How do you use that?
Yeah. I'll hit that one for a sec first.
Yeah.
Okay, so when I see an anxiety thing, for me that is an extremely strong gut-brain connection. It is amazing how fast you can modulate that one downward, especially in a young age, because they often haven't had enough time to burn out their adrenals yet.
Right.
Right? So older, I start looking also, not only, but also at adrenals. But at that young an age, it's usually a food trigger of some sort. So we get rid of that, clean up the gut, and just kind of see what happens. Yeah? If that wasn't enough, then you have other layers you have to jump to.
Now, on the other side, there's a family. There's hereditary component to ADHD. And so this is behaviorally speaking, she's learning to manage her environment through creating anxiety. And so she has a gut kind of going, well, this is okay to do. And then her brain's like, yeah, this kind of works. So in a way, she's creating her own Adderall response. That makes sense?
Yeah, no.
Probably not scientifically, but
This is why it's so important to be integrative, where you look at it from the different angles, isn't it? And I love this stuff.
yeah.
So this could have been situational and occurred in utero somehow. Okay, there's no way to prove that. I know, for instance, and this is a very shallow example, but one of my 5 kids was born with incredibly bad teeth, incredibly bad. Like there was hardly any enamel on it, and it took a lot of work just to keep things going there. Okay, so what happened there? And I did some puzzling, and I remember, my wife had that one flu, she spiked a fever for that one day, and I'm sure it was right in that development time of then. Does that make sense? It's not my wife's fault at all. So I'm not trying to do a guilt trip here because there's so many variables out there. Okay, but that happened right then, and then we were stuck with bad teeth. So there's all kinds of events that can happen in utero. It's just a perfect storm. So it could have been something like that. Okay.
Now, I would like to add, you're not a bad parent.
Yes.
Okay? And so when I see, in fact, you just spoke exactly to one of my questions, whether or not he has ADHD, he has ADHD-like symptoms. Behavioral work would work with him, and you do want to do that behavioral work with him. Usually when I see ADHD families, especially with 7 children, I mean, immediately I start calculating the odds of, so 4, right? 4 out of 7 given brain structure, would have brain structural differences. And so because you're not seeing that, I would probably guess it was environmental. Did that answer your question? Or?
Yeah, it did. I have a couple that are busy but are young, and they don't seem quite as bad. With him, he was diagnosed with the disconnect with the brain.
Yeah. And remember, there's a disconnect you'll see, not just bad behavior. Young women are under-identified. My daughter Caitlin has ADHD. She just worked quietly and more diligently, but it took her so much longer to actually do work than her peers.
And I would like to, you mentioned busy, some of my kids are busy. I find that busy does not get celebrated enough. It gets looked at as an annoyance. And yes, it is work, I get that. But folks, that's not ADHD. These kids should not be medicated, and
Right.
it's a crime. So sometimes busy is just a personality normal.
Or being intelligent. Intelligent people are quite busy, right? They're taking things apart, they're examining things. So let's not jump to, busy is bad.
Mm-hmm.
But we do need to channel energy, right?
Maybe this is a silly question because I'm sure it's all positive, but what role does exercise play in mitigating some of the health effects? Yeah.
Huge.
And
He can tell you why, but I can tell you huge.
One
I
of
know
the,
it's always good, right?
one of the best therapeutic tools out there, it's called the backyard. It's incredible. Let these kids get dirty. Okay, so they're feeding their microbiome. They're getting exercise, they're getting oxygen, they're getting light therapy. It's unbelievable how beneficial all those are.
But this goes for grown-ups.
Oh,
Grown-ups
same thing.
need playtime. And grown-ups need time, not in front of a screen to play, but they actually need playtime. And playtime for adults in nature, combined with exercise, you can actually speak more about this, removes plaque.
Yeah, it's amazing what kind of regeneration occurs in the entire nervous system, not just brain, just with exercise. It's proven over and over and over. I find the research fascinating because it shows that any exercise is beneficial, but then there's gradients of exercise that are beneficial for the brain. So walking on a treadmill is better than sitting on a couch. Yeah. So again, any exercise is good, but then the research, this is from McMaster University, also showed that walking through a city is better than going on a treadmill. And then it took it another step further. If you can have some green space mixed in there, we're getting even more benefits. And they had some pretty sophisticated tools. The very best of all was vigorous walking through a pine forest. It seemed to gauge the senses in certain ways that immunity went up, inflammation went down more than any other kind of exercise. Fascinating. And there's no way they could have studied everything. But so there's gradients of exercise. Yeah.
To ask a different way, how much of what you're experiencing and seeing today is due to a lack of?
You can hit that one.
Oh, thank you. I don't know. But here's what I do know. When I see students who have low prefrontal cortex activity, who really can't remember things, it increases the likelihood of reducing their symptoms. I know I just said that in researcher speak, but it's likely, and it always helps. The problem with a lot of ADHD folks is they downshift because their brains are revved up all the time during school. Like, we have to be alert, we have to watch. They come home and they don't want to exercise. And this is adults coming home from work too, right? We call them man caves for a reason, right? And so we downshift, and we stay mentally shifted, which means we don't want to exercise and break that inertia. We don't want to have to rev back up because it seems like a rev up again. So if I can get my clients to exercise, they report feeling fantastic. Did that?
Yeah, the mental exhaustion makes you believe that you're physically exhausted.
Oh, well done.
You haven't balanced the two out.
Yeah.
Yeah, well done. Yeah.
It's awesome. If I can add just one more little tidbit.
Yeah.
Joke at the denBoer household is Dad believes strongly that exercise helps or cures any condition. Oh yeah. Yeah.
You made a comment earlier about over-exercising
Yes.
and its effect on the brain.
Yes.
So let's say you have someone who over-exercises,
Yep.
2-3 marathons a year.
Yep.
All of a sudden they're injured, boom. What does that do then to the brain, to this?
Okay. That's a really complicated question.
Yeah.
No, that's okay. This is good. The brain adapts to almost any situation. Okay, it's incredible. It's called neuroplasticity, and it's unbelievable how it makes things work. So it's used to the flooding of cortisol. It's used to the toxicity of too much exercise, because that comes in a toxic state. It's used to the inflammation, and all of a sudden, all those things get dumped. The patient's actually going to be worse off.
Yep.
It really should look like a wean down, right? There's obviously benefits to running for the brain. That's obvious, but maybe not to that level. So the dumping of exercise is more stressful than the exercise itself.
And some of my clients actually use exercise as a coping mechanism. And because we have 2 speeds, on and off, do we ever do anything in moderation? Oh no, my friend, never. And so it's, I'm training for a marathon, and they're killing their body, soaking, or I'm not getting off the couch. Moderation is very, very difficult.
Yes. So both of us being parents, and both of us having gone through that 15-year-old stage, me 5 times, right? And I, at that age, your levers become less effective. They just are. And so therefore, it definitely takes an outsider voice with your support implementing it to make this work. And it really depends on the child. Some of them, you're ready to tackle a bunch of things. Others, you're just going to tackle one thing, and you do it one step at a time. Don, could you speak to that? Because we do that in health coaching here.
Agreed. Baby steps a lot of times for that overwhelmingness. And we just pick apart what are you willing to do? What will you take ownership of? And then we build from there. Because as you start to do one thing, you begin to feel a little bit better and a little bit better, and you make that connection. And I agree wholeheartedly with what you said. Sometimes it's an outside party, especially with that age group. To hear it from someone else, to learn it from someone else, and help educate and support them through that outside of mom and dad can really be helpful.
And the cynical behavioralist in me says, oh, there are levers, because they live with you.
Yeah.
And we do know about ADHD brains, there's it's a shortened cycle between the reward centers. And so reward the behavior you want to see. So outsider, and then
You got to grab whatever lever is the biggest lever. And whatever
that's,
it is.
I actually use the word like, all right, what levers do we have here, parents? And I work with things like bedtime and eating, things like that. That's
Yes.
You talk about the prefrontal cortex and differences in brain. It sounds like that's permanent. I mean, is there a way through functional medicine and coaching to turn back on the frontal cortex, or has it been proven that they're just permanently like that?
Well, what Dr. denBoer said is because of neuroplasticity, we rewire. And so there's a lot of research that although ADHD people are somewhat poorly adapted to modern life because of the prefrontal cortex issue, that doesn't remain. Sometimes we can get more blood flow there, but it's not going to be the strongest part. But the brain does rewire. And so what we do is rewire in healthy ways. That's my answer.
No, I think that's perfect.
Okay.
You can always improve. Sometimes you can't eliminate. I see that this is slightly off topic with our Parkinson's patients. It's amazing how well they could do, but there's always that little bit remaining that's a bit of a challenge. And good. I think we should wrap it up. I'm getting hungry. So I really appreciate you coming to visit. That was super instructive.
Thanks. Thanks for having me.
It's fun to talk about these topics. I appreciate the attention. I hope you got something out of it. It will be available on YouTube in about 2 weeks' time. In the meantime, we're going to publish the adrenal video. That is brand new. That'll be going on hopefully this week yet. So be looking for that. And that really syncs with this whole ADHD problem.
When will this one be up, Doc?
This one?
Yep.
Lucas?
A week or two? Probably about a week.
For everybody except Tamara's husband.
Right. This didn't happen, guys. He thinks I'm at a coffee bar. No, just joking. My poor kids and family.
Yes.
Thanks, everyone.
Yeah, thanks for being here. Thank you.